Good morning. Welcome to today's meeting. Item 1 on the agenda, information papers issued since the last meeting. No paper has been issued so far, so item 2, items for discussion at the next meeting. Please refer to the list of outstanding items for discussion and list of follow-up actions. The next regular meeting is scheduled for 10:45 a.m. on Monday, 15th of September 2025. The administration has indicated that the proposed items will be ready later, and once the Secretariat is informed, a circular will be issued to members. On to item 3, supporting NGOs operating subvented welfare services to optimize resources. The administration has submitted a paper, so let's invite the administration to come in. Members, if you want to speak, please press the request to speak button. I will give each member 4 minutes questions and answers. 8 members in fact have indicated they wish to speak. I will read the names out in this order, starting with Mr. Chen Chen-ying, and then Mr. Anman Yu, Mr. Stephen Ho, Dr. Johnny Ng, Mr. Kingsley Wong, and Mr. Chao Su Chung, Mr. Kwok Wai Keung, and Mr. Dennis Leung. Mr. Chen, Ronick Chan, you may start now. No, why don't we ask the administration to walk us through the paper first? Right, sorry, my bad. Let's invite the Undersecretary for Labour and Welfare, Mr. Ho Kai-ming, to walk us through the paper. Right. As in 2001, the SWD has been implementing the lump sum grant subvention system to provide subvention to NGOs operating welfare services. The system seeks to focus on the effectiveness of service delivery and hence allows NGOs greater flexibility and higher efficiency in utilizing funds and providing quality services. Subject to their compliance with the FSA or funding service agreements and relevant statutory requirements, NGOs may flexibly deploy resources to achieve service output and outcome. And I want to supplement that before 2001, many of the services were directly provided and operated by the government. So we will have regard to the staff, establishment, and service standards in determining the scale of the relevant agreements. When it comes to public-private partnership programs, usually, in theory, the government provides the hardware. When it comes to service standards, we adopt the ones developed before 2001. Now we want to continue to make improvements to ensure that the NGOs can optimize resources and provide training. We want them to continue to provide professional development to enhance operational efficiency. The SWD issued the Social Welfare Services Lump Sum Grant Subvention Manual to NGOs, setting out the standards and requirements related to corporate governance, human resources management, financial control, etc. And on a regular basis, the SWD also gets an understanding of these matters through exchanges and sharing sessions with the NGOs was to provide timely advice to them. In order to help them optimize the use of resources and enhance operational efficiencies, the SWD has implemented various support measures. For example, the Social Welfare Development Fund was introduced in 2009, totaling $1 billion to provide training to with $300 million funding to NGOs to implement 700 IT system enhancements. And all the system enhancement projects were completed in 2022-23 or earlier. In 2024, we set up a 5-year dedicated fund of $500 million. We also set up the I&T fund for application in elderly and rehab care, called I&T Fund. $2 billion in total were injected into the fund to subsidize service units in procuring, renting, and trialing tech products to lessen the burden and pressure on care staff and carers and to promote the use of IT. We also have a learning platform and other arrangements, such as shouldering some of the financial burden of NGOs. We also have measures to remove obstacles and cut red tape so as to provide stronger support to NGOs. These include a reduction in the administrative procedures to enhance operational efficiency, as well as allowing the retention of the funds exceeding the cap of the LSG reserve. The SWD continues to conduct regular reviews on the relevant schemes so as to enhance operational efficiency of NGOs. We also encourage NGOs to adopt proactive and innovative approaches to optimize the use of human financial resources and flexibly adjust services so as to enhance the services more effectively. Yes, the floor is now open. Mr. Monique Chan, 3 questions. First, according to the paper, the SWD has shouldered some of the financial burden of NGOs, that is the impact on them brought about by the productivity enhancement program. That means more time will be given to NGOs to prepare for the implementation of the adjusted PEP. Now, how long is this buffer period? Because supposedly the reduction should happen here and now. So how much time are you going to give to NGOs to cushion the impact? Second question. Since the SWD will be devoting some of their own resources to support the NGOs, will the normal operation of the department be affected? As I understand, for the surplus, a part of the surplus is placed with the exchange fund for investment. And then the other question is that according to the media, some of the senior managements of NGOs are actually fat cats. Their pays are not reasonable. So despite having a board of governance for these NGOs, will the government also conduct a comprehensive review of the pay levels of the NGOs concerned? And according to our review report, there will be a review on the 3-tier pay structure of the NGOs. The mainstream view is that the structure should be further flattened. So would you consider reviewing the structure itself so as to further streamline the big hierarchy? And the Secretary, right, I think members do understand that on the whole we are facing some financial constraints, but with risks comes opportunities. That means we want to make sure that money is well spent. We need to optimize resources, and that is why we are shouldering the financial burden of NGOs to some extent. And perhaps I'll give the floor to my colleague to further explain that. On the whole, we want NGOs to try different ways to cut spending. For example, by introducing energy-saving projects, they can save up to, say, $10 to $20 million on utility bills. And this way, we help NGOs enhance operational efficiency and also optimize resources. The other point is about the pay for senior management of NGOs. On their websites, we require disclosure of this information. For example, let's say for an NGO with an establishment of several thousand, the top management is pegged to the level of, say, D1 within the government. So this is somewhat a reference scale for them. If the pay gets excessively high, we'll need to make sure that the pay is pegged to the so-called reference scale. I'll see if Ms. Chan would like to supplement. All right, thank you. Let me supplement the information on cushioning the impact of the productivity enhancement program on NGOs. There are 2 types of NGOs. And the first approach applies to all types of NGOs. For the supposedly 1% cut in 2024-25, this amount will be absorbed by the SWD. And also for 2025-26, I mean, of the 179 NGOs 121 of them received less than $50 million funding. So in 2026, 27, and 27, 28, the SWD will shoulder the cumulative reduction of up to 4% for them. And that's the reduction will be absorbed by SWD on a long-term basis. That means these NGOs will only face a 3% cut ultimately. And to answer the other question on a 3-tier structure, and the perception on the pay, we consider the size of establishment, the number of subvented or subvention recipients in assessing the appropriate pay level for the top 3 tiers in the NGO, or the average pay for the staff. Now, like the Undersecretary said, the official is supposed to be pegged to the pay of a D1, and if it exceeds that level, then we're going to reject their proposal, because we have a reference scale. The pay should be pegged to that of D1, and we will take follow-up action. Mr. Amenyu, I have 2 questions. First, this is the panel on public service. So I'm concerned about the staff of these organizations. My question is about the productivity enhancement program. With budget cuts, I'm concerned about staff remuneration and their work condition. Does the government keep statistics in this regard, for example, the impact on the pay and downsizing of organizations, and whether as a result some staff members will be redeployed to other service units? So my concern is on change in the establishment and pay structure. The second point is about training for low-ranking staff. I like to propose collaboration with Civil Service College. Now, of course, there are some courses for professionals that must be run by the social welfare sector only. But there are also courses relating to leadership skills, etc. And I wonder if the NGOs can entrust the Civil Service College to provide training. Right, I will give the floor to the Assistant Director to say more on the PEP. But I want to clarify that it's for the NGOs to carry out this primary responsibility of utilizing funds. Now, I already explained the ways of cutting spending, such as adopting energy-saving measures. Now, we have not received any such proposals yet, but if the NGOs are to, say, do away with some of their staff, then they may need to explain their proposal, because as explained, among the 179 NGOs, 121 of them have benefited from the government's commitment to shoulder their 4% cut, so that they actually just have to implement the 3% cut. Now, and then the NGOs will have to explain why they are downsizing the establishment instead of adopting other measures. Right. The other point is about the Civil Service College. I thank Mr. Ngan for the comment. I understand that the Civil Service College already has quite a lot on their plate, especially they are operating training courses for frontline staff. So there is a lot on their plate. We do find partners. For example, we have the link, or the we ask the Federation to help run some of these courses.
I'll see if Mr. Chairman has anything to add. Sure. When asked about the impact on employees, after the resources are allocated to the organizations, there is flexibility for the organizations to determine the employee structure and the pay for employees. For each organization, the circumstances and the system are different. So we do not have stringent management in this regard, but we do encourage organizations to have a pay that is attractive enough for employees, and they should have a stable team. For the PEP, we have some support measures. Excuse me, Chair. I think they can just give me some figures due to time constraints. So can you tell me how much of a cut there was for employees after the promulgation of the PEP? I do understand there is flexibility for the organizations to act. So can you just tell us how many employees have been cut since the promulgation of the program? Excuse me. I believe there have not been any news of cuts of employees made by the organizations. I believe if there is such instance, we would receive a report on that. Thank you. Thank you, Mr. Stephen Ho. I do note you have provided some details in the paper, but you haven't talked about the specific figures. You do have a training fund amounting to $1 billion. So I want to ask, how are you gauging the effectiveness of training? According to paragraph 6 and 7, you have some training to help staff members develop management and supervisory skills. Why do we need to provide specific training on management and supervisory skills? Because the organization should have already provided such training. Why does the government have to pay for such training? If you are training them for new skills, it makes sense. But if you're just talking about management and supervisory skills, it does not make much sense. And I also want to ask, for the different size organizations, will you have different treatment for their funding and training? I think you should provide more support to the medium and small size organizations to enhance their competitiveness, so that they can compete with the larger organizations when trying to apply to certain projects. Otherwise, you would just have the larger organizations handle all the projects. I'm not saying they can't, but I think there should be better support for small and medium-sized organizations. I also understand that you are trying to provide national security training to the staff members of the organizations, but not many have actually undertaken training in such regard. So have you tried to ensure compliance by the organizations in their employees undertaking such training? I think we need to make sure they are complying with such standards, because they are on the front line in reaching out to citizens. Thank you. Mr. Ho. Thank you. We try to adopt a fair treatment for the different size organizations. I do understand what the members said. However, we want to enhance competitiveness of the small and medium-sized organizations. But I also think when tendering for projects, the government does not have a preference as to which organization should get the project. We want the organization to be the most appropriate one for the particular project. So we do not have any plans to help smaller and medium-sized organizations to win the bids for some projects. As for national security training, we did report to the panel on welfare services on this. We have a $100 million budget for providing national security training. I'll let Ms. Chan talk about the details for applications to such training. Thank you. For national training, we have $100 million for mainland visits and training courses to be provided. For mainland visits, we have two categories. One category is partnership with organizations, and the organizations would have their employees take part in such training. And we have 4 visits held, and 1,400 staff members participated in such visits. We have made visits to social welfare organizations in the mainland. Let me ask some follow-up questions to get some specific details. So I want to ask if you have covered more organizations. I'm not asking about the sheer number of employees who have taken part. I also want to ask, when you say you're adopting a fair approach, it's just your opinion, because if they have different starting points, it is not fair to them. It's just like those who come from a wealthier background would have more extracurricular activities. So I think we need to consider, from a welfare perspective, we need to have a fair starting point. Thank you. Mr. Ho, we will have comprehensive training for the next 5 years. We do note the comments of Mr. Stephen Ho as well. Thank you. Dr. Johnny I want to follow up on what is said in paragraph 9. We have $1 billion injected. It is an additional amount injected this year for the INT Fund for Application in Elderly Rehabilitation Care. What is the size of the fund at the moment? How many organizations have benefited from the arrangements of the fund? Can you share with us some of the significant outcomes of the fund? We have received feedback that there aren't many options available as they have in Japan. So how can we do better in this regard? Thank you. I'll let Ms. Chen supplement the figures. We have some specific success examples. For this fund, it is not available to the general public. It is for those who are already living in homes. Because this is for the residents who are going home from time to time and they can still have support. We have seen many disabled persons benefiting from the fund. They can now walk with such aid, especially those who are living in the hostels of RCHDs, so that we don't need as much manpower to support their daily living, and the disabled persons can sustain their daily living with such support. Thank you. Ms. Chen, we have used $820 million of the fund so far. As for those that have benefited from the arrangements, we have 2,100 service units that have benefited from such arrangements. They have purchased over 24,000 pieces of equipment. That's it for what I have to supplement. Thank you. Mr. Kingsley Wong. I would like to thank the chairman for making today's discussions happen. First, we have funded operations of many service units so far, but the government has not practiced stringent monitoring. We have seen employees of the service units saying that the employees' work may be the same, but there is different pay. And for senior personnel, they are receiving $2 to $3 million per year, and it would be 10 to 20% of the pay paid to employees of such service units. So how can we resolve these issues? What is the direction of the government in this? For the structures of the organizations, we do have some KPIs, but it seems to be only on paper. Can we implement reforms specifically to the structures of service units to make sure they are providing services rather than have the funds channeled to the pay of employees of the service units, especially the senior personnel? So how can we reform these service units, basically? We have also had some scandals with service units before. Have we had accountability of personnel of these service units? If there is poor management, say we have had child abuse incidents with service units who are supposed to protect children, how are we going to make sure there is proper management so that poor management does not persist? Thank you. Mr. Ho, I think we practice stringent regulation so far, unlike what the member said. For the newer service units, they actually express how much regulation the government has for them compared to before. Not only is there management with funding, but say for the organizations operating family services, they are subject to regulation from the Social Welfare Department. There's also regulation by the ICAC and other departments. So there is much regulation, and we have actually received some complaints about that in a way. As for employees receiving different pay for similar work, it has always been the case for the public service, the civil service, that they will have pay scales, but then for service units, they may have 5 to 6 social workers, and they would have pay for that, but then they can also choose to hire more social workers with lower pay. This is the flexibility the organizations have with their provision of services. But if service units are to provide the same pay to the employees by asking for more funding from the government, sorry, that won't happen. So if they choose to expand their structure, they may have to sacrifice pay to employees. I think there are many questions that are unanswered. I think the question about accountability has not been answered. There has not been any reply to the effectiveness to the work of the service units and why there is higher paid comparatively to senior personnel. I'll give you 2 more minutes to answer the relevant questions. We do regulate the organizations, but when they do not deviate from the framework, we do not really micromanage them. Let me address the question in particular for higher pay comparatively to senior personnel. We practice stringent regulation for organizations. They need to have self-assessments for the 3 tiers of employees of their organizations. They also need to submit to us information about assessments of conditions of service for the employees. They need to tell us the number of employees for each tier and the pay information. Once we have received the reports, we will make comparisons to the civil service pay. And if they receive higher pay, they need to change that. Excuse me, I have a short follow-up question. We have seen scandals in the social welfare sector. When such happen, will you be able to make people become accountable when you have identified issues in your inspections? Thank you.
That means if there's a scandal involving an organization, how do you implement accountability? Right, if something goes wrong in an organization, we'll take them to task. They will be required to make improvements within a specified time frame. And we will have regard to the nature of the incident and the seriousness. We will issue either a warning letter. I want to know in the past 5 years how many such requests have been made. Right, for the CRH incident, we did issue this warning. I think the member is not asking a yes or no question, but the number. We don't have that in hand. We will provide the information after the meeting. Next, Mr. Chow Siu Chung. Madam Chair, the government actively encourages or assists NGOs in optimizing the use of resources. I think it is necessary for the sake of enhancing operational efficiency. The government should monitor the NGOs to make sure that efficiency is enhanced and resources are optimally used. That means the government should have the basic understanding of the operation of NGOs, such as the establishment, specific pay structure. The government should get the basic understanding or request that information be provided. In fact, in the last review exercise, that is a review on the lump sum grant subvention system, a consultancy firm tried to get an understanding of the pay conditions of different organizations, but only 30% of the NGOs responded to the survey. We need this survey so as to get a proper understanding of the pay structure of the NGOs. And because of the poor response rate, I'm sure that the accuracy of this survey, the findings of the survey, will be put into question. The second point is this. I think my feeling is shared by other members. Whenever we ask oral questions, written questions, or when we put questions to the government in this council, we often receive the same reply from the government, and that is we do not keep statistics. And again, the government also responds in the same way to media inquiries. In fact, what is relevant to today's topic is that in relation to welfare, poverty alleviation, and childcare services, for over 100 times, the Labour and Welfare Bureau has responded to questions by saying that there is no record available or no information available. So quite some members are frustrated. The government is supposed to be monitoring the NGOs. Although it's true that under the system, NGOs are at liberty to exercise flexibility in resource utilization. However, at least the government should ask the NGOs to report to you the pay structure or how resources have been used. The other point is that a review report on the lump sum grant subvention system was submitted in July 2021, and the subcommittee then recommended that permanent posts be established under the lump sum grant pay system and that the specifics should be drawn up to enhance transparency of the pay structure, including the starting pay. According to the consultant, a 5-year transition period could be put in place. Now, it's been almost 5 years. I want to know the latest progress, whether a timetable is available. And the Secretary, indeed, we have not kept statistics in relation to some matters. Right. I think the member's question is that whilst understanding that there is no record or data available, you should start collecting data now. Well, if we require the NGOs to provide so much information that we might as well run the organizations or provide services ourselves. This is against the intention of the LSG, and that is why we want to provide flexibility to the NGOs. We don't want the government to directly provide the services. We're not therefore delving into these details. If we ask for every minute detail to be submitted to the government, there will be a lack of flexibility. It would go against the principle. However, we're not leaving behind the underprivileged, and that is why we do ask for information in relation to the pay of the top 3 tiers, which is the concern of the public. I'll give the floor to the AD. In relation to the pay structure for permanent posts under the lump sum grant subvention system and the starting point of the pay scale, NGOs are required to keep statistics, but they are not required to submit the information to us. Just to supplement, Madam Chair, does it mean that the ball is in the court of NGOs and that the government can just turn a blind eye? The question is, if you want improvement, the government should also keep the relevant statistics. I don't think it's a daunting task to ask for information to be provided. It won't cost you a lot for statistics to be kept within the government. Because very often when you say that no record is available, you haven't actually asked for the records, right? We look at service delivery targets and the number of users served. We conduct regular inspections, but we do not always ask for information to be provided during the inspections. Next, Mr. Kwok Wai Kang. Madam Chair, I need to declare that I graduated from social work in year 2000. So I need to make this declaration. Had there not been the introduction of lump sum grant subvention system, I would never have joined the sector, and I won't be here today. So whilst we are discussing the merit of the lump sum grant subvention system, we must also discuss the provision of manpower and delivery of services. Now, Madam Chair, for the former, as mentioned by the Undersecretary, lump sum grant subvention system provides flexibility to NGOs. That means, according to the FSAs, it is possible that the NGO split 8 posts into 16 altogether. There may not be impact on service delivery, but from the perspective of the staff in question, their rights are being deprived of because their pay would be cut by half. And according to media reports, 55% of NGOs have their own pay scales. The remaining 45% relies on the government's reference pay scale. So my question is, has the government looked into matter and see whether there is a wide gap? We need to address the issue of same work, different pay. In reality, the management of different NGOs are actually quite well acquainted with each other. So my question is whether there is a joint effort to make sure that staff pay remains at a low level and that there is now a recruitment and retention problem in the sector. Now, the other question is according to experienced staff in NGOs, they are caught in a dilemma because they cannot change jobs in another organization because the experience will not be recognized. So this is akin to the administrative officer grade within the government. Has the government reviewed the situation for the sake of retaining experienced manpower? My next question is about NGOs moonlighting, so to speak. They may bid for other services outside of the scope of FSAs. Have you considered the issue of manpower, whether there is any duplications? Under Secretary. Now, same work, different pay. I think we explained the logic. I need to stress that for the pay level is for the market to decide on the matter. Among the 179 NGOs, if there is a major pay gap, then a staff member will wish to apply for a civil service job instead. We also need to safeguard employees' rights while striking a balance between that and proper use of public funds. Say, for 8 jobs being split into 16, the workload may be halved as well. So we want to make sure that the resources are optimally utilized. AD will supplement about staff planning under LSGSS. We adopt a reference typical staff establishment structure in the FSAs. We provide, for example, roughly the level of manpower needed for different ranks, etc., and then we provide the subventions to the organizations for them to flexibly decide on the organizational structure. Next, Mr. Denslow. Thank you, Chair. Under Secretary just explained that some NGOs may recruit 16 staff members for the workload of 8, and then the workload would remain the same, the pay would remain the same as well. If that is true, why don't the Undersecretary give us a concrete example of that? Because if this is true, then we have 179 NGOs in Hong Kong, and definitely they will be able to provide better services. So if you have this example, do tell us. The discussion today relates to the use of subvention by these NGOs and their operational efficiency. Now, as asked by other members, the first question is about the highest echelon of the NGOs, usually the leaders. In the past decade or so, we've been hearing the same complaint, and that is these are fat cats receiving high praise and the lower ranking staff are exploited. Since 2001, when the LSGSS was introduced, over the years, has the government conducted any detailed study? Has the government collected views from the sector to see whether this is a real problem and that whether this problem has remained over the years? This is exactly what we want to tackle. We want to see whether frontline social workers are receiving the level of a pay that would help them make ends meet. Apart from considering service delivery, we need to consider the frontline workers in these NGOs. The third point is about budget cuts. This year, we need to cut spending by 1%. What is the rationale of the SWD shouldering the financial burden of the NGOs? Because for the education sector, budgets are slashed right away across the board from kindergarten, primary, secondary schools to universities. So why is it that despite the financial pressure affecting everybody in society, the social welfare department is shouldering or absorbing the reduction for NGOs? Has the government considered exactly what the problem is? Has the government monitored the NGOs properly? Why is it that despite so many problems surrounding many NGOs, they still receive heavy subventions? As I understand, some NGOs are not receiving government subventions. Are they able to provide services up to standard?
Undersecretary, well, when they receive services, the service standards may not be clear. As for the pay of employees, when we talk about something being unchanged, it's with the subventions, but then organizations have the flexibility to determine the pay of employees, and that is not subject to our control. We also have, in the last 2 years, we have more organizations having to hire care workers, so that may have affected the pay of certain employees because the subventions have not changed. Thank you. I'll let Ms. Chen supplement some information. For the senior personnel, how many organizations have engaged CEOs earning D1 equivalent pay? Only 4 organizations are eligible for that. Let me say that first. And they have received lump sum grants. Each organization has over 1,000 employees under their management. Thank you. Mr. Lam San Kung, I have a question about the INT Fund for Application in Elderly and Rehabilitation Care. So we have subsidies for service units to procure, rent, or trial technology products. I want to ask how many of such products are developed locally? Do you have any figures on that? And we are trying to encourage people to retire in the Greater Bay Area. And we do have some service units providing relevant services in the Greater Bay Area. So does this fund arrangements cover the service units providing services in the Greater Bay Area? Thank you. Undersecretary, most of the products under the fund are developed locally. We do have also some products coming to the mainland and overseas, but that would be a minority. We have a vetting committee, so they need to gauge local data as well. So it is more likely for a local product to be eligible for the fund. As for service units in the Greater Bay Area, whether they're eligible for funding under the fund, they are not at the moment, but they are already on the list of Greater Bay Area service units, so they are entitled to some subsidies already. Thank you. Well, I appreciate the reply given by the administration. I'm glad they are making use of local products. Thank you. Mr. Lai Tong Kwok, I have a simple question. According to the annex, the lump sum grants provided by the Social Welfare Department, most of them are used for pay. I don't think they can do much in pay because that is often included in the contractual clauses. So when you are cutting the services, or what is the percentage of it exactly? Thank you. I'll ask Ms. Chen to answer that question. Thank you. We are cutting the total amount of the subventions. So we have a percentage cut in the total amount of the subventions. As for pay to employees, they will increase with reference to civil service pay. In the last financial year, we have a 3% increase, so there has been a 3% increase, and this year it remains unchanged. Well, what I'm asking is, have you determined a percentage for expenditure that must be used for expenses other than pay? We have a general threshold for expenditure for pay, provident fund support, and other expenditure. And indeed, most organizations have 70 to 80% use in pay to employees. Well, that means only 20% is being used in expenditure to provide services. So if you are cutting 1%, that would mean a 1% in the 20% because the pay to employees will not change. Either that or they should cut costs in, say, electricity by trying to save more energy in their use of appliances. But then if they don't do that, they need to, again, withdraw funds from the 20%. So have you told organizations how they can save energy, for example, and how they are achieving the same service standards without cuts to the services while facing cuts in their total subventions? Thank you, Undersecretary. Well, we have energy-saving bulbs available, and if they use energy-saving bulbs, we actually do provide some sort of support in them trying to adopt energy-efficient measures. And if they apply for government funding, or if they are partnering with the government on certain projects, we will be more generous in the splitting of costs so that they do not need to have the administrative burden of trying to do accounting. Well, I think these are just minor administrative costs. You should not ask them to make a report in the first place if you already have such information on hand. Undersecretary, we do note Mr. Lai's comments, but then we have the arrangements for them reporting to us. For example, they have received funding from the Home and Youth Affairs. In future, we'll see how we can try to streamline the arrangements. Dr. Tik Chi-yun, I want to clarify something about how only 20% of the government subvention is used for providing services. It is therefore very hard for social welfare organizations to cut costs further. Right now, from what I heard, the social welfare sector had not had significant employee cuts, but the sector is actually trying to take advantage of natural wastage, and they're not replacing employees once they have left. So we have less employees. We will not be able to provide as many services. Morale of employees will be affected for sure. And we have further cuts in expenditure in the next few years. How can the sector not be affected? In fact, we have seen history show that this has happened and it has affected the sector. The sector does not anticipate this because we have contracts with the government. So we are asked to basically do 100 things with $90. The government has essentially breached the contract with social welfare sector. How can the sector provide the same level of services? The financial secretary said we should tide over the financial difficulties together, and that the social welfare sector should help as much as they can. But then the financial secretary said recently that they will achieve fiscal balance in the coming year. So why not stop cutting the expenditure starting from next year to the social welfare sector? When you're cutting expenditure to the sector, we're cutting provisions to elderly and children's services. The sector is greatly affected, and you have heard feedback from the sector that services are being impacted. So please stop the government from cutting expenditure in the social welfare sector for the next few years. Let us have some breathing space. Once the economy gets better, you should not cut the expenditure to the sector. Thank you. Undersecretary, we have been trying to cut resources paid to organizations to encourage more efficiency in the sector. Essentially, Dr. Tick is threatening the government that they are cutting provisions because of the cut of expenditure by the government. If organizations told you this, can you please tell us which organizations said this in particular, trying to threaten the government? If they have this mindset, they should not be running projects by the government. We have not heard any organization say to us that because the government is cutting expenditure or subventions to the sector, they are cutting services. It should not be an excuse for the organizations to cut provisions of services. We have actually more support than ever for organizations. That, for example, we have the dedicated fund for providing training to organizations. If they have this mindset of asking the government not to cut government expenditure to the sector by cutting provisions of services, I think that is not right. We have not heard that before. If Dr. Tick has heard that, please convey the specific messages to us for our follow-up. Thank you.
Well, Madam Chair, I asked the Undersecretary to take back his words. I never uttered the words threatened. We never threatened the government on this issue. I'm just saying that in the past we received a 10% cut, and now we have to our budget have to be cut further. You want to You need to abide by the FSA in terms of workload. This will impact on our staff morale. We're not threatening you. I want the government to understand the needs of the people and the sentiment of the frontline staff. So I ask you to take back what you said Don't say that we're threatening you. We are doing our best to solve problems. Madam Chair, please refer to the minutes of the meeting and the transcript of the record for what I uttered and what I meant. Well, then I express my deepest regret if the Undersecretary does not take back his words. Right, second round, Mr. Kwok Wai Keung. Thank you, Chair. I have this question from the paper starting from 2001. The government has signed FSAs with the organizations. Now, these FSAs have been in place for over 20 years. Has the government conducted any review as to whether these FSAs are catching up with the times? Is it necessary to draw up new ones? I want some information. And then to pick up on the question in the last round, 55% of organizations have their own pay scales. 45% of the organizations used the government's reference scale. So do you have any information? I'll give the floor to the Assistant Director. I want to supplement that indeed we have reviewed the FSAs. It's been over 20 years since 2001. Some services need refinement in scope. There may be new modes of service delivery as well. I can give you examples such as the shelter workshop and integrated vocational and rehab service centers. We are in the process of reviewing the arrangements and we will be rolling out new arrangements. We don't have figures at hand. We'll provide the information afterwards. What about the 55%, 45%, and the relevant pay scale issue? I think the question has been repeated. We need to go back and check whether this information is available. We will provide the information after the meeting. Second round, Dr. Tik Chi-yun. About the use of resources. About maintaining flexibility and cutting red tape. The Undersecretary once mentioned that the social welfare sector should harness AI or IT to enhance operational efficiency and streamline manpower. Specifically, I want the Undersecretary to tell us how AI can be leveraged by the welfare sector so as to enhance operational efficiency and optimize resources. Again, I'll give the floor to the AD. Well, not just about AI, but about information technology. On the whole, we encourage organizations to adopt I&T more widely. For example, we have established a dedicated fund as at the end of June, we received over 50 applications for I&T projects. Some of these I&T projects involve the use of AI. The overarching in principle is to encourage IT organizations to adopt I&T to enhance efficiency and save manpower. Madam Chair, I want to emphasize that we have been doing the same in the past, and as I understand, the biggest challenge is to do the government's bit in using AI or I&T in elderly care and rehab care. In fact, this is already the global trend and we are not catching up. We need to do more. The next point is that we need to gauge the effectiveness and see whether we have achieved results. I want the government to report to the panel. Lady. Thank you, Chair. Well, we are encouraged by the results. As I mentioned, we just rolled out the dedicated fund. It will be good for the next 5 years, and will continue to encourage NGOs to adopt I&T. And after rolling out the I&T projects, they will be required to submit assessment reports for us to review the result. For example, whether by using AI or I&T, they're able to enhance efficiency and save manpower. Right, if there are no further questions, we will now move on to the next item. Oh, right. Not for the next item, right? I haven't started yet. The next item is overview of medical and dental benefits for civil service eligible persons, CSEPs. There are 2 papers submitted. Let's invite the administration to come in first. If you want to speak, please press the request to speak button now. We're joined by Mrs. Ingrid Yang, Secretary for the Civil Service and her team. May I invite the Secretary to walk us through the paper? Thank you, Chair. I'm joined by the Department of Health, Hospital Authority today, and I'd like to brief members on the latest overview of the provision of medical and dental benefits for CSEPs. The government, as the employer, has an obligation to provide medical and dental benefits for civil servants according to the conditions of service. Services are provided by the government through the Department of Health or the Hospital Authority. They cover a wide range of services such as GOPC, SOPC, imaging and diagnostic services, as well as dental services and Chinese medicine services. CSEPs may also apply to the Department of Health for reimbursement of medical expenses for drugs, equipment, and services prescribed by the attending doctors according to the conditions that are not available in the HA or Department of Health. Details of these services can be found in paragraphs 3 to 8 of the paper. Next, we will focus on the use of I&T and flexible use of resources so as to continue to enhance the quality and quantity of services for CSEPs. For medical services, now starting from February this year, the DH has rolled out an online booking system for family clinics. It's very much welcomed by the service users. Over 95% of bookings have been made since its launch. And according to retired civil servants and their eligible family members, despite the age, they are still able to make bookings through the online system. In view of the increasing demand for families clinic services, we'll set up a new one in Cheung Kwan O government offices, which will be commissioned in the 4th quarter of 2025. And to optimize the use of resources, patients of Cyclone FC will be passed to the Cheung Kwan O FC to receive services. We also plan to set up an FC at the Kwun Tong Composite Development Project. And depending on the work's progress, it is expected to commence service gradually from 2027. As for GOPC, operated by the Hospital Authority, we have a new option for Book GOPC module in the HA Go mobile app for CSEPs. As for evening sessions, we've now extended the scheme to cover 3 GOPCs starting from April 2025 to better cater for the needs of civil servants taking up night shifts. Last year, we rolled out a pilot scheme to provide free vaccine shots for CSEPs for seasonal influenza. Over 15,000 individuals received the vaccination. We will launch the next round of the pilot scheme before the arrival of the next winter influenza season. As for dental services, as reported to members in December last year, we extended the pilot scheme from December last year to July 2026 so as to arrange for about 2,000 or 140,000 CSEPs to receive a one-time scaling service. We also have the one-year pilot scheme for on dental services in Shenzhen. About 2,000 CSEPs will be arranged to receive dental services in Shenzhen. This can help alleviate the long waiting queue for dental services. We also exercise innovation as well as stepping up recruitment for dental officers. Now, we've achieved results from September last year to June this year. A total of over 60 newly recruited dentists, including contract dentists, had reported duty, enabling the department to gradually reopen some dental clinics from the first quarter of 2025. We will also build new dental clinics. The one in Chengguan government offices will first come into operation by phases from the third quarter of this year. As for the dental clinics in Kuntong and Chaiwan, depending on the work's progress, they are expected to commence service gradually from 2027 and 2028, respectively, at the earliest. For Chinese medicine, in November last year and in July this year, we increased the disc for civil servants by 5,000. From 2021 to now, the service quotas for civil servants for CM services have increased by 70%. And we're discussing with the hospital authority in relation to the scope of CM services for CSEPs at the HA premises at the Chinese Medicine Hospital of Hong Kong. We will keep in view the implementation of the measures, including the pilot scheme on dental services in Shenzhen, to chart our way forward. We'll also closely liaise with the Department of Health and Hospital Authority to continue to enhance medical and dental services for CSEPs. 5 members would like to speak, starting with Ambrose Lam, Dennis Leung, Ronick Chan, Johnny Ng, and Chow Siu Chung. Mr. Ambrose Lam, thank you. I stand to be corrected. According to the paper, 570,000 individuals are CSEPs eligible for medical and dental services, and that's really roughly 8% of the population in Hong Kong. According to the service users, in general, for medical services, the staff are polite and they deliver services well. As for dental services, there are lots of complaints. Very often, even if you have an urgent situation, you'll be given painkillers at best, and that there is always a long queue for dental services, up to half a year or a full year. I have 2 suggestions. The government should set up a penalty mechanism for booking government clinics. If there are 2 defaults consecutively without advance notice, their eligibility should be suspended, or that they cannot make online booking in advance. They must attend the clinics in person. The second suggestion is that in light of the surge in the number of retiring civil servants, and at the moment we have 507,000 CSEPs, there should be separate queues for retired civil servants and serving civil servants in the booking system. Secretary. Now, for defaults for medical and dental services, these users will need to line up again, and that means a very long waiting time. I thank Mr. Ambrose Lam for the suggestions, for example, asking the defaulting individuals to come in person so as to make sure that they will be responsible for the bookings they've made. And about civil servants' discs, the original intention is for them to receive medical attention as quickly as possible, so that if they are fit enough, they could return to work as quickly as possible. Or, say, if they suffer from communicable diseases, or if they're unwell, they can get a day off to prevent the spreading of the disease. Now, this is designed for civil servants only, and not for other CSEPs such as relatives or retirees. The third point is that indeed the CSEPs include retirees as well as their eligible family members. So altogether 570,000 150,000 CSEPs are recorded. But starting from June year 2000, we have made a major change to our recruitment approach. We're more akin to a private organization now, and that after retirement, the civil servants will no longer enjoy the medical and dental benefits. So in the coming few years or in the coming decade, the number of CSEPs will reach the peak, and then the figure will gradually come down. We will keep in view the service capacity to see whether we're able to meet the demand. And as I mentioned, there are also ways to consolidate resources to provide better services.
Mr. Dennis Leung, I want some more information from the administration. As the Secretary said, we have only 190,000 civil servants in service. So for the 570,000, many of them will be retired civil servants. Can you provide more information to us when you anticipate the number of CSEPs will peak? And when will we have similar numbers of retired civil servants and in-service civil servants in the number of CSEPs? For dental services, because we do not have an adequate number of dentists under the Department of Health, we are unable to provide adequate dental services to civil servants. But we have already seen amendments made to the dentist registration ordinance. We have dental program graduates having to undergo internship under the hospital authority or the Department of Health. So how many will that be exactly? And will that help improve service standards of services provided to civil servants? Thank you. Secretary, for the second question, I'll let the DH colleague answer that question. Let me give you some basic figures. The number of CSEPs is 573,000 at the moment. We have 176,000 civil servants. We have also the others being retired civil servants and the family members of in-service and retired civil servants. We expect in 2031 we will have 600,000 CSEPs. We have the estimates for pension. So we understand that in 2033, around then, we will have the figures for CSEP's peak. Now I'll hand over to the Department of Health colleague to answer the second question. Thank you. Thank you, Secretary. The Dentist Registration Ordinance's amendments will apply to the dental program graduates graduating this year. They will need to undergo an internship with the hospital authority or the Department of Health. With this arrangement, we will have the undergraduates being exposed to more scenarios for the application of their skills. So they will undergo rotation for their internship. We have 70-odd graduates this year. They will rotate through different postings. So regarding what you said, how many of them will join the civil service dental clinics? It will be about 1/4 to 1/5 of them. So it may not significantly improve the service standards in the civil service dental clinics because the aim is to have them have more exposure to different settings, clinical settings, rather than trying to fill the manpower gap in civil servants dental clinics. Thank you. We have 74 general outpatient clinics, and we have some specialist outpatient clinics. We also have 6 family clinics for civil servants. But I understand that we only have a 60% usage rate for civil service discs, and then we have 65% of them in the previous year. We will have more families clinics in future, so we may not need as many disc quotas for general outpatient clinics. Will you review the situation in due course and then reduce the number of civil servant discs with general outpatient clinics so that more citizens can have a shorter waiting time for such clinics? We also have the dental scaling pilot arrangements for civil servants to undergo scaling, so have that reduced the waiting time of 24 to 48 months previously. Lastly, on Chinese medicine clinical services, we will have 110,000 available in future. So that is quite a lot. It may be more quotas or places compared to the general quota. So I want to ask, Chinese medicine may be more popular than Western medicine. So if we anticipate more people switching from Western medicine to Chinese medicine, we may need to consider reducing the quotas for civil servants to ensure better allocation of resources. Thank you, Secretary. We do keep in view this situation for different general outpatient clinics. We have adjusted the disc quotas among the clinics for those that have more civil servants frequent. We actually have more quotas. We also have the quotas available to the general public if civil servants do not use up the discs. But we need some room for capacity because for the peak season, say the flu season, we may have more civil servants making use of the discs. So we need to ensure there are adequate disc quotas. For dental services, we do have pilot arrangements. The 2 schemes for dental services, dental scaling, and the pilot scheme on dental services in Shenzhen. I can only give you some rough figures because these are scaling services. For civil servants that need more than scaling services, they would still need to queue for public dental services. So in general, we have reduced the waiting time from 29 months to 16 months, but this is just an average. It is not applicable to every case. For Chinese medicine services, we have had the Chinese medicine clinics. We have not really observed a decline in demand for Western medicine services. I guess it's because we have different needs for people going to Western medicine and Chinese medicine services. For those obtaining Western medicine services, they probably want a quicker solution. For Chinese medicine service users, they probably want to have some chronic conditions managed. So I would say we will continue to monitor the demand for Chinese medicine services. We do understand that they are received very well. We will see in future if we can have specific civil service Chinese medicine clinics. Right now, however, we are only aiming for some perhaps specific service provisions for civil servants at the Chinese Medicine Hospital. Thank you. Dr. Johnny We have over 570,000 individuals eligible for civil service medical and dental benefits. How much are we spending on this? As the Secretary said, the number will only peak after 10 years. So I want to ask for the next 5 years, how much of an increase in the costs we'll have. And the CSEPs will include in-service civil servants. We also have retired civil servants and their eligible family members, as well as surviving spouses and children. If we have the civil servants having moved to overseas, are their families still eligible for the benefits? For surviving spouses and children, if they have moved overseas for many years, are they still eligible for such benefits? Thank you. Secretary, in terms of costs, the Department of Health and the Hospital Authority provides services with resources from the envelopes from the Health Bureau as well as the Civil Service Bureau, specifically for civil servants. Altogether in 2025-26, the budget is $2.9 billion, all things included. But the Hospital Authority provides additional services. It is because when the Hospital Authority had yet to be established, we had the Department of Health managing civil servants' medical and dental benefits, and the body receive a lump sum then to provide services in general. So we do not have specific allocations for civil servants' medical and dental services in particular. For those having moved overseas, as we do not provide such services overseas, they will not be able to get the services. But then if they come back, they can receive such services in Hong Kong. It only applies to family members. Yes, but we have a threshold for family members. For children, once they are 19 or above, they cannot receive the relevant benefits, but spouses can continuously receive such benefits. Thank you. Mr. Chao Siu-chung, I have a question about paragraph 4. As the Secretary said, we have quotas because we want in-service civil servants to receive priority treatment and return to work as soon as possible if considered fit. If they are not considered fit, they should probably take sick leave. But I have had more than a civil servant tell me, for a general outpatient clinic in Wenchai, as I said, more than one civil servant told me this. After they have registered at 8:45, they can only receive consultation or treatment at 11 or after. So have we gauged the situation in clinics to make sure there is indeed priority accorded to civil servants? I also want to ask about paragraph 12. We have nighttime civil servant discs available. And I actually asked before if we act on the premise of not impacting on daytime services, can we increase the number of discs further? Because even with 3 clinics, it is not ideal to have civil servants get services in the evening. I also note We now have 110,000 places for Chinese medicine, but the utilization rate is quite high. It is over 90%. So we have the Chinese medicine to be commissioned soon. What are the specific services that may be available for civil servants at the hospital? And I actually asked before. The secretary replied then she would liaise with the health bureau. It has been 1.5 years since. Can you tell us about the latest progress? Lastly, in March 2020, the Department of Health has an integrated care program at families' clinics. These services are only available to the diabetes patients at the moment. Will that be extended to patients of other chronic illnesses? Thank you.
Secretary. Thank you. Madam Chair, the first question is about civil servant discs and the waiting time at GOPCs. Whether adjustments can be made, I'll give the floor to the HA later. Let me first take the other questions. The second question relates to civil servant discs for the evening session. The pilot scheme has been extended to 3 clinics in Hong Kong, Kowloon, and the New Territories. Now, for the 2 in Kowloon and Hong Kong Island, respectively, they are rather accessible. Civil servants in need will find them rather convenient. Now, for the one in the New Territories is actually in NT East, and I agree that if you live in NT West, it may be quite far away. We'll discuss with the HA and see whether there is room to operate more. Now, at the same time, we have to be mindful of the fact that there aren't many civil servants working at night, so the demand is apparently less than that in daytime. And we also need to abide by the overall principle that the services for the public must not be compromised. For the Chinese Medicine Hospital of Hong Kong, as we understand, upon early commissioning, only outpatient services will be provided. Inpatient services will be provided at a later stage. As for the quotas or discs available to civil servants, we need to get an understanding from the Bureau to see ultimately how many discs will be set aside for civil servants. We also need to find out the exact mode of operation, whether the clinic will be open for any walk-in patient or whether referrals are required. The third and the fourth questions related to the integrated program. I will give the floor to the Department of Health and see whether this program can further cover other types of chronic diseases. I'll now give the floor to the HA to take the first question. Right, on civil servant discs, I thank Chairman and Secretary and Mr. Chow for the questions. We have 66 GOPCs under HA offering civil servant discs. The utilization rate among the 66 clinics are different, and Mr. Chow just now mentioned Violet Peel GOPC in Wan Chai, and indeed the utilization rate is particularly high, and we conduct review on a regular basis to make sure that as much as possible more discs can be provided at the Wan Chai clinic. Starting from January this year, we also developed a new function in the HA Go which allows CSEPs to make booking via the app. In the past, you might need to visit the clinic in person at 8 so that you can get a disc at 9 in the morning. But there are different sessions. Now with the HA Go app, you can just make a booking via the app and arrive at the clinic at the scheduled time instead of waiting all the time in the clinic. Any other members who'd like to ask questions about the integrated treatment program? In 2020, it was introduced in the Families Clinic for Civil Servants, and one clinic now provides this service. We want to improve the quality of care under the integrated care program for patients with diabetes, so that with early prevention, early intervention, we can better manage the condition and prevent complications. We've chosen DM because DM is a condition that may affect multiple organs. Early treatment and early prevention of complications is necessary so that the condition will not affect other organs such as the eyes, the kidneys, and the brain. This is based on clinical evidence, and that is why under the integrated care program we have cross-disciplinary teams to manage the patient's condition. And we'll keep in view whether it is possible to extend the program to cover other chronic diseases so that these conditions can be managed properly by cross-disciplinary professionals under the integrated care program. As for our next step, we have 11,000 DM patients using the Families Clinic services. The integrated care program will be extended to cover the Fanling FC in future. Right, thank you. I have a question about dental clinics. 11 dental clinics were suspended because of COVID and also manpower shortage. I understand that you have 60 new recruits and you're going to reopen some of the clinics. Now for Mona Fong Dental Clinic, the one in Wan Chai and the other in Tung Chung, you plan to resume the operation. What about the remaining 8 clinics previously suspended? What is the reopening schedule? I understand that 3 new dental clinics will be commissioned in the future. So my question is on the remaining 8 which have been suspended, any reopening schedule, and also the timetable and arrangements for the 3 new ones. I'll give the floor to the Department of Health. Thank you, Chair. Thank you, Secretary. Yes, we plan to reopen these clinics. We've recruited 60 new dental officers to fill vacancies arising from normal retirement and other reasons. So we need to consider the net gain after recruiting the 60. While we commissioned the one in Tung Chung in March this year, in June we commissioned the Mona Fong Clinic, and in August we will also reopen the Wan Chai Dental Clinic. The Secretary also mentioned a new one in Cheung Kwan O. So for the time being, we are recruiting dental officers to fill vacancies, and we are doing our best to reopen clinics. According to the timetable, there are 9 more clinics to be reopened. We'll start with those in the urban districts first. As you know, we have a dental clinic in Tai O, Cheung Chau. We are providing public service in Cheung Chau, but we will start with the urban districts first. We'll also need to consider, for example, the turnover of dental officers for this year before considering the reopening schedule. So you don't have a concrete timetable for the remaining ones? Well, we will do our best to reopen all of them within this year and next year. You talk about the net gain, it's not as many as 60. So exactly what is the net gain? In the past few years, we about 60 and 70 officers left the grade every year. So that means no net gain. We've been doing our level best. As for the vacancy rate, it has dropped from slightly over 30 to 22%. So we'll continue with your recruitment efforts, right? Of course, we have never relaxed our efforts. Right, if there are no other questions, that wraps up today's meeting. I thank everyone for attending today's meeting. AOB. Nothing under AOB. Meeting's adjourned. Thank you.